name is Skylar Perlman. I'm an occupational therapist from the University of St. Augustine. Before we get started, can I get the patient's date of birth and first and last name?
Her name is Eleanor Smith, and her birthday is January 1st, 1940.
Okay, awesome. Thank you. Just making sure I'm in the right room. And just to kind of get my bearings and everything, what relation do you have with the patient?
I'm her daughter.
Okay, great. So before we get started, do you have any questions for me?
Yeah, I have a couple of questions. So I was wondering what exactly is occupational therapy?
Okay, yeah, that's a great question. I know that a lot of people kind of get us confused with PT. There's a lot of similarities, but definitely some differences there. So basically, my goal as an occupational therapist is to work with a client to enhance their ability to engage in occupations they want to, need to, or expected to do so by modifying not only their occupation or but also their environment. And then all this better supports their occupational engagement. Occupations are activities we participate in every day. Those can be sleeping, feeding, bathing, toileting, stuff like that. And then occupations also occur in context and are influenced by a multitude of things, like client factors, performance skills, and performance patterns. And just a little bit about client factors are just kind of values and beliefs, and performance skills are is kind of what helps you get through the task, so like motor skills and stuff like that. And then the performance patterns are just habits and routines that a person does daily. And so, like I said, as an occupational therapist, I'll evaluate each client using an occupational profile, which is just an interview to kind of get the client's history and their interests and values. And then I will conduct an analysis from that occupational profile, and then I'll plan and implement and review an intervention that best suits the specific client, so in this case, Eleanor. And then lastly, I kind of will assess her outcomes, and those are just directly correlated with what she's achieved through her specific intervention. So I know that was kind of...
Okay, perfect.
Yeah, that was a lot, but that's kind of just basics of what OTs do. I know we also help with education, so just kind of preventing any further injuries. We also kind of help educate you as the caregiver, because I know you'll be taking care of, I assume you will be taking care of Eleanor for the time being?
Yes.
Okay, yeah, so we just kind of help you, educate you, like just on Eleanor's conditions, and just kind of preventing those like future injuries.
Perfect. So I know you mentioned something about feeding earlier, so I was wondering how I would be able to help with her, since she does have that weakness on that one side.
Okay. Yeah, that's a great question. So, she, like I said, she will definitely need some help reaching for things, because she doesn't have, she has that left-sided paralysis and kind of inability to just kind of hold herself upright. So what I would say is that because she has that left neglect, that she's not going to see things in that side of her vision field. So maybe if you hold it closer and more to her right side of her vision field, that will help her kind of see like the utensil. I did notice during the evaluation that she can functionally brush her hair and wash her face. So she can independently do stuff like that. So I believe as long as she can see the utensil, she can definitely grasp onto it, and we can if need be, we can get her assisted adaptive utensils. But I do believe that she probably will have a little difficulty to the utensil to her mouth because of the vision difficulties.
Okay, perfect. And then the same thing with toileting and bathing. How how am I supposed to help her with that?
So yeah, like I said, she's unable to maintain her like postural balance, and because of side weakness, it's going to be really challenging. She's not going to be able to do any of these things herself. So for you, I will teach you like different transfers, specifically not just from getting the bed to a wheelchair, but also just from getting her from a wheelchair to a toilet or wheelchair to a shower, bench, or anything like that. And I'm hopeful that with just practicing range of motion and like manual muscle testing and all that stuff, that she'll eventually be able to assist you when you're doing the transfers. But as of now, you're going to need to be able to do all of that for her.
Okay, perfect. So you mentioned a wheelchair. Is that what she's going to be using at home?
I believe for right now, her best fit would be the electric wheelchair, and just because of all her side effects due to her CVA. If, like I said, I am hopeful that she's going to improve. First 6 months is usually when all the improvements for a stroke happen. So it's only been a few weeks, so I'm very hopeful. And then from there, I would like I said, if I do see improvement, that we could probably change her assisted device and either get her to a wheelchair or just a normal wheelchair, or even a rolling walker.
Okay, perfect. Those are all the questions that I have right now. Mom, do you have any questions?
No.
Okay, well, like I said, I'm really hopeful that Eleanor is going to be able to improve. Like I said, it is, with stroke patient, it definitely depends on the individual. We can see really big improvements, or we can see not as big of improvements. But like I said, I'm hopeful that we'll be able to at least get her back to any type of kind of like functional independence and stuff like that. But it's definitely going to take quite a bit of work, and I know she's in inpatient rehab, so I will be seeing her every day for the next 6 weeks. And like I said, if you have any questions, anything, just let me know. I'm here for both you and Eleanor during this process.
Thank you so much.
Thank you.